Hi, friends. Dr. Kevin Lynch here. Thank you for attending. This is our first edition of live stream Pet Mindset, and we appreciate you being here. Thank you. For those of you who are joining us for the first time, I've spent over 50 years caring for pets and their families to protect the bond, to protect the bond between animals and their families, and to enhance the life they share with their pets. Tonight, we're going to talk about something very important. We're going to talk about prevention and how does prevention figure into preserving the bond and that wonderful relationship we have with our pets. Most of the problems veterinarians see don't happen overnight. They tend to occur incrementally over time. And what we're trying to impart to folks is how to watch for signs in our pets that allow us to identify problems when they're small before they become big problems. It's the big problems that are expensive and painful and require intervention that sometimes is life threatening to the pets that we're trying to help. So, if we can get people to be aware in a conscious way of how to protect their pets early on in any disease, illness, or any developmental problem they have with their pets, that's a win-win for the family, for the pet, and even for veterinarians, because we are in your corner. We want to see these pets stay as healthy as they can for as long as they can throughout their lives. And we're going to answer your questions, tell some stories along the way, uh, review things that I've learned throughout decades of practice, and hopefully we all learn something tonight. There'll be some questions coming through, I'm sure. And just be sure, folks, to tell us where you're calling in from. Tell us where your pet is located. Leave us your pet's name. We want to know about your pet. We want to know where in the world you're calling in from to be able to identify your pet firsthand. Question coming in from a gentleman in Austin, Texas. Wow. And another gentleman from the great city of Pittsburgh. Wonderful, wonderful. Far afield. If you have any questions, just fire away, folks. I'm here to help. We have somebody from Orlando in Florida with 4 cats. Cats are just wonderful companions, aren't they, Lobardo? We have 2 cats in my own household, and they're fast friends. They're their own community. People don't realize that cats are very much a community. There's a hierarchy in cats, and these creatures are so uh, silent sometimes compared to dogs, but they speak volumes in their relationship in another way. People have to develop a sense of the specialness of cats and the fact that cats are not as liable to uh, whine or vocalize like a dog might, or still doesn't mean they don't perceive their surroundings and their family in a very special way. And the reaction to one another is amazing. So there's a question coming in. Pets are named Fiji and Rio. Well, one's a rescue cat, and another one an offspring of a cat rescue as well. That's wonderful. That tells me that you have a caring heart uh, to take in animals that need rescuing. You know, my own feeling is rescue is such an under discussed uh, topic in the world. The more animals that can be rescued and put into loving homes, the better. And don't forget, not just young pets to be rescued. There are pets that are in the middle age and seniors, and they need that loving relationship, no matter what their age, of somebody that loves them and respects them for who they are. Uh, Definitely drop your questions below, and let's talk about anything that you need to talk about. But I love the topic, as I said, of prevention. Prevention is so important to maintain that wellness aspect in a pet's life, both emotionally and physically. Good preventative observation stems from the first time you get your pet, knowing their body, knowing what's normal on their body, looking for changes. One of the great topics we talk about at the Pet Mindset is dental disease, and it's we call it the tip of the medical iceberg. Why do we call it that? Because so many other health issues come out of dental disease. The evidence is there by people just being aware to look in their pet's mouth, look at the teeth, look at the gum line, see if there's redness or inflammation. These are signs of bacterial action that it's as important in their lives as it is in ours. We brush our teeth every day. Animals, unfortunately, don't clean their mouths daily. So there has to be a way of cleaning. And although some chew objects are non-damaging, many times things that people give animals to chew on can be potentially damaging, not only to the mouth, but can be swallowed and become a foreign body or cause GI upsets. And there's a lot of things on the market that you must be very careful with. So Raphael has a question. My dog Max is a bit overweight. Is there anything you recommend for a diet? I think one of the unsung categories in nutrition is the addition of fruits and vegetables that are safe to an animal. In dogs, we have such an emphasis on feeding them protein and fats, more flavor many times than good nutrition. And this extends also to treats. A lot of treats are loaded with fat and flavoring and red dye and things that animals can't even see. The colorative dyes are often something that only the human owner perceives. The animal can't even see it, but it's there to attract us to think that it's a meaty treat. If we were to substitute for many treats, things like apples and carrots and melons and blueberry and strawberry, bananas, things that are certainly in your home, you know their origin, they're not laden with animal fats. And if we can get our pets to become used to these things early in life, think of the preventative ability of those fruits and vegetables to prevent weight gain. When you love an animal by giving them things to chew on that are fatty in nature, you're literally loving them into an illness. I don't want to say loving them to death, but food is not love. Love is love. And you have to be mindful to watch for things that go into your animals' mouths. Same thing's true in cats as well. Many treats on the market are just way too fatty. And again, when we talk about prevention and preservation of health, it's so important to take them through each stage of their life in the best shape they can be, not to have them overweight and have early onset arthritis and develop liver disease and develop breathing problems, cardiac disease, the diabetes. The amount of diabetes we see in animals today is skyrocketingly alarming. And a lot of it reflects the diets that we're pumping into our animals. Simpler foods, and this is not to say that home cooking is a bad thing, but if you're going to home cook, be mindful to look for the canine and feline equivalents of the Mediterranean diet, emphasizing vegetables and fruits, things that are safe. It always doesn't translate to protein. I think there's far too much protein as animals get older, and attendant fats that are surrounding those proteins. So prevention is everything, and preventing the obesity epidemic is so important. A lot of these notions that I'm talking about are in my recently published book called Off the Leash, Tales from a Lifetime of Healing Pets in Wonder. It's available at drkevinlynch.com/book. The chapter under obesity is called The Widespread Epidemic, and it really is true. It is something that the animal population endures unnecessarily. We have far too many calories in and far less calories going out with exercise. And speaking of exercise, what's the safest exercise for our dogs? Walking. Walking is excellent. It's good for us. It's good for them. If you can have your pet moving every day, you get the benefit of that communication by walking with them, being with them, nurturing them, talking to them. All of that is wonderfully experienced by just walking on lead. And don't let them run off lead. Let them be controlled. Let them have that messaging, that conversation that a good leash training produces. I find some of the best moments in my pup's life are when he's on lead and having that directive energy output that walking produces. Don't take an overweight pet and start throwing a ball around the yard, folks. I can't tell you how many times we've seen joint injuries, things that are preventable because people say, well, we're going to get them on a forced march now, and it results in bodily injury. Gradually increasing their energy output by walking is the safest exercise. Cats are also susceptible to obesity. There are wonderful laser toys and things that engage their predatory instincts that help them to play and hunting behaviors. But it could be something as simple as a crumpled up piece of paper that you toss across the floor. And the cat learns to not only attack, but retrieve. It's amazing what cats are capable of. They're very intelligent animals and they love to interact. Question coming through. My cat is a rescue. He's a bit overweight, a bit underweight. Any advice? Interesting. We deal with so many overweight animals. That's the usual question. When they come out of rescue, my experience has been they've been through some sort of stress. The rescue organizations, the shelters in this country are marvelous at desensitizing the mental trauma that oftentimes is attended to an animal going into a rescue situation. And I've dealt with some incredible rescue people in my 51 years. But if an animal comes to you and they're underweight, well, they could commonly still have parasites, although many rescues will worm these animals. There are a host of parasites that are not worms. There are protozoan parasites, things that we see commonly that don't get picked up, like Giardia or a protozoan called Coccidia. These can influence bowel health. They can come to you with bowel disturbance, diarrhea, sometimes bleeding in the bowel from these protozoans. The first thing you want to do when you rescue an animal like that is have them settle in a bit, make sure they're eating and drinking, and then get them a good physical exam by a veterinarian. Bring a stool sample. It's something that I can't tell you how often people forget to bring in a stool sample to the veterinarian initially on the first visit. It's super important. Let's make sure this animal that supposedly was wormed is truly parasite-free, didn't pick up anything from the time they were wormed to the time they come to your hands in transport or in containers. And these are weak links in the chain of transfer that you must be mindful of. There are times when some animals that are apparently healthy still have medical problems that can only be discerned with running some lab work, understanding if they're healthy, truly healthy or not. Don't forget, as we talked about adopting an older animal, sometimes they're harboring age-related changes in their body to many body organs, all of which can result in being underweight because they cannot absorb food properly, or they're nauseous, or they have issues with digestion. So you want to get them a good physical exam if your mind tells you this is not normal. particularly if you have other animals that are in better shape at similar ages. So again, it's all that preventative mindset, mindset that says you're going to be the pet parent in every regard. You know, we often say at the pet mindset that we empower pet parents to protect the bond between themselves and their pets. That's what it's all about, folks. Protect the bond, protect that relationship that is so special and fulfills the reason why you have these creatures in your life. But protecting the bond is being the pet parent that is a good observer, and you're in their corner for that reason. So let's see, other questions here. What are the subtle signs that someone might be something might be wrong with the cat's mouth? They are often subtle, dog or cat. Sometimes animals will begin to, as we discussed, frankly, lose weight. If they have dental disease, if they have gum disease, if they have devitalized teeth, they stop eating the proper amount of food. Some of them develop odors from the mouth that weren't there previously. Some of them will begin to drool heavily or have blood evident in their mouth, bloody drooling. Some of them begin to chew on one side of the mouth or the other, trying to keep away from a damaged tooth or a focus of infection. There are times too when they can begin to literally lose so much weight that they're in danger. They're in real danger. If you have doubt about what you're seeing, if you think these signs are serious enough, get them a good exam. Be the pet parent and take them to a veterinarian. And that's very important to in the way of managing dental disease. Because of that, by the way, that whole discussion of dental disease led me to develop a microfiber device that is available online. It's called a Plaque Begone device, and that's a picture of the package of the Plaque Begone device. It's microfiber based, and it has replacement heads that are affixed to either end. It's based on the gentle effect of microfiber to relieve plaque from teeth and gum lines long before it can harden into tartar. Heretofore, people have used things like toothbrushes. Human toothbrushes should never be used in an animal's mouth. Animals have 3 times the amount of nerve endings in their mouth that we do. When you take a toothbrush to an animal's mouth in a scrubbing motion, you're hurting them. You're turning them off. You can do it once, you can do it twice, and then they're headed for the hills. The Plaque Begone device is a very simple and effective alternative because the microfiber has the ability to absorb plaque to itself and take it out of the mouth. That is key to preventing dental disease and preventing tartar that devitalizes teeth. It's so important to do it gently. It's not a scrubbing motion. The microfiber is simply massaged at the gum line where the bacteria and food film that represent plaque are laden, and it absorbs that material, takes it out of the mouth. Don't forget, unlike us, animals don't rinse and spit. We use a toothbrush. You're moving debris around, but then you rinse and spit to get it out of your mouth. An animal doesn't have that capability. When you use a toothbrush on an animal, you're just simply moving the debris to other parts of the mouth. It's not extracted. The Plaque Begone extracts it painlessly, used on a daily basis. It's an amazing tool for maintaining oral health. And I didn't set out to invent the Plaque Begone device as much as resolve a problem that was so frustrating to see day in and day out in practice. And the effects of dental disease are incredibly evident in our animal population. Is a question coming in, would the Plaque Begone device by itself be good on its own, or can I supplement it with anything? Sure, you can. As previously discussed, I really like the use of crunchy fruits and vegetables like apples and carrots in dogs, and broccoli stems, things that normally you would toss out, cauliflower stems, crunchy fruits and vegetables. And by the way, there are fruits that and vegetables we never give, like grapes, raisins, raw onion, raw garlic. Very dangerous, poisonous to animals. Bear that in mind, folks. We don't want to expose them to anything that's going to make them sick. So there are chew toys that I think are safe. I do love Nylabone products because they're indestructible. They're made from a hard nylon substance. But what I don't give my own pets, and what I've seen in practice all too often create huge problems, are splintery bones, bones that they can chew on 10, 20 times, and then off comes the arrowhead. And that arrowhead of bone goes into the intestines and creates all sorts of problems. So you don't want to be guilty of doing that. There are things that are on the market too that are liquid based. Some of them are meant to dissolve tartar and plaque, but they're very caustic and irritating. And I think that those things should be avoided as well. So the device is cool, as somebody's commenting, and I think it's cool. I think it's a great approach to a problem that doesn't violate the bond. Remember, that don't do anything to hurt the bond between you and your family member that runs on four legs. That's important. And by the way, pets come in a variety of sizes and shapes and species. I had occasion in my own practice to actually care for a toad that was, matter of fact, this story's in my book. And it was Tommy the toad that came in, and he had a laceration on his abdomen from the kitty in the family. We actually were able to repair the abdominal wound on this toad and give him back to the young man that was tearfully crying and bidding his friend goodbye. And that was quite an episode. One of the most rewarding episodes of my professional career. I got Christmas cards from Tommy the Toad for 3 years after we sent him home to his loving family. It's all in the book, as I mentioned, Off the Leash, Tales from a Lifetime of Healing Pets and Wonder, and available at drkevinlynch.com, as is the dental device, by the way. So, word to the wise, folks. Everything we do with animals is because we love them, and they're in our lives for a loving relationship. But don't violate the bond by introducing anything discomforting. Everything you do should have mindfulness, should be the part of being the pet parent. And empowering pet parents to protect the bond between themselves and their pets is everything that the Pet Mindset Show is about. Nice talking to you, folks. Take care.